How to treat and cure premenstrual syndrome. Premenstrual syndrome, PMS, refers to physical and emotional symptoms that occur in the 1 to 2 weeks before a woman's period. Symptoms often vary between women and resolve around the start of bleeding. Common symptoms include acne, tender breasts, bloating, feeling tired, irritability, and mood changes. Often symptoms are present for around 6 days. A woman's pattern of symptoms may change over time. Symptoms do not occur during pregnancy or following menopause. Diagnosis requires a consistent pattern of emotional and physical symptoms occurring after ovulation and before menstruation to a degree that interferes with normal life. Emotional symptoms must not be present during the initial part of the menstrual cycle. A daily list of symptoms over a few months may help in diagnosis. Other disorders that cause similar symptoms need to be excluded before a diagnosis is made. The cause of PMS is unknown. Some symptoms may be worsened by a high-salt diet, alcohol, or caffeine. The underlying mechanism is believed to involve changes in hormone levels. Reducing salt, caffeine, and stress along with increasing exercise is typically all that is recommended in those with mild symptoms. Calcium and vitamin D supplementation may be useful in some. 1. Anti-inflammatory drugs such as naproxen may help with physical symptoms. In those with more significant symptoms, birth control pills or the diuretic spironolactone may be useful. Overview symptoms. Visiting the doctor. Treatment. Severe PMS outlook. Read this next. Understanding PMS. Premenstrual syndrome, PMS, is a condition that affects a woman's emotions, physical health, and behavior during certain days of the menstrual cycle, generally just before her menses. PMS symptoms start 5 to 11 days before menstruation and typically go away once menstruation begins. The cause of PMS is unknown. However, many researchers believe that a change in hormone levels at the beginning of the menstrual cycle may be to blame. Levels of estrogen and progesterone increase during certain times of the month. An increase in these hormones can cause mood swings, anxiety, and irritability. PMS symptoms affect up to 85% of menstruating women. Risk factors for premenstrual syndrome include a history of depression or mood disorders, such as postpartum depression or bipolar disorder. Family history of PMS. A family history of depression. Symptoms of PMS. The average woman's menstrual cycle lasts 28 days. Ovulation, when an egg is released from the ovaries, occurs on day 14 of the cycle. Menstruation, bleeding, occurs on day 28 of the cycle. PMS symptoms can begin around day 14 and last until 7 days after the start of menstruation. Symptoms of PMS are usually mild or moderate. The severity of symptoms can vary by individual and by month. Symptoms of PMS include abdominal bloating and pain, sore breasts, acne, food cravings, especially sweets, constipation, diarrhea, headaches, sensitivity to light or sound, fatigue, irritability, changes in sleep patterns, anxiety, depression or sadness, emotional outbursts. If physical pain, mood swings, and other symptoms start to affect your daily life, or if your symptoms don't go away, you should make a doctor's appointment to have yourself checked for other medical conditions. Your doctor may ask about any history of depression or mood disorders in your family to determine whether your symptoms are the result of PMS or another condition. Some conditions, such as irritable bowel syndrome, hypothyroidism, and pregnancy, have symptoms similar to PMS. Your doctor may do a thyroid hormone test to ensure that your thyroid gland is working properly, a pregnancy test, and perhaps a pelvic exam to check for any gynecological problems. Keeping a symptom diary is another way to determine if you have PMS. Use a calendar to keep track of your symptoms and menstruation every month. If your symptoms start around the same time each month, PMS is a likely cause. Easing the symptoms of PMS. You can't cure PMS, but you can take steps to ease your symptoms. If you have a mild or moderate form of premenstrual syndrome, treatment options include drinking plenty of fluids to ease abdominal bloating, eating a balanced diet to improve your overall health and energy level, eat plenty of fruits and vegetables and reduce your intake of sugar, salt, caffeine, and alcohol. Taking supplements, such as folic acid, vitamin B6, calcium, and magnesium to reduce cramps and mood swings. Sleeping at least 8 hours each night to improve fatigue. Getting plenty of exercise to decrease bloating and improve your mental health. You can take pain medication, such as ibuprofen or aspirin, to alleviate muscle aches, headaches, and stomach cramping. You can also try a diuretic to stop bloating and water weight gain. Take medications and supplements only as directed and after speaking with your doctor. Severe PMS, premenstrual dysphoric disorder. Severe PMS symptoms are rare. Some of the small number of women who have severe symptoms have premenstrual dysphoric disorder, PMDD. PMDD affects between 3 and 8% of women. Symptoms of PMDD may include symptoms of PMS. There are many symptoms associated with PMS. The most common symptoms can be grouped into emotional and physical symptoms. Emotional and behavioral symptoms can include anxiety, mood swings, tiredness, irritability, anger or aggression, depression, a loss in confidence, clumsiness, difficulty sleeping. Physical symptoms can include headaches, feeling bloated, increase in appetite or food cravings, pain in your joints, tender breasts, abdominal, tummy, pain, backache, spots. These symptoms aren't unique to PMS, it's the timing of the symptoms that indicate if you have the condition. If you have PMS, your symptoms will appear during the 2 weeks leading up to your menstrual period. Get better by the end of your period. Come back each month. If you have premenstrual dysphoric disorder, your symptoms will be similar to those for PMS, but more severe and will include significant emotional symptoms. The most significant symptom tends to be irritability. These symptoms may be caused by problems other than PMS and premenstrual dysphoric disorder. If you have any of these symptoms, contact your GP for advice. Depression or thoughts of suicide. Panic attacks. Extreme anxiety. Anger. Crying spells. Lack of interest in daily activities. Insomnia. Trouble thinking or focusing. Binge eating. Painful cramping or bloating. Like PMS, symptoms of PMDD may result from changes in your estrogen and progesterone levels. There is also a connection between low serotonin levels and PMDD. Serotonin is a chemical found in your brain and gut that affects your moods, emotions, and thoughts. Your doctor may do a physical exam, a gynecological exam, a complete blood count, and a liver function test to rule out other medical problems. They may also recommend a psychiatric evaluation. A personal or family history of major depression, substance abuse, trauma, or stress can all trigger or worsen PMDD symptoms. Treatment for PMDD varies. Your doctor may recommend daily exercise, vitamin supplements, such as calcium, magnesium, and vitamin B6, a caffeine-free diet, individual or group counseling, stress management classes, birth control pills. Yaz is the only birth control pill approved by the FDA to treat PMDD symptoms. If your PMDD symptoms still do not improve, your doctor may give you a selective serotonin reuptake inhibitor, SSRI, antidepressant. This medication increases serotonin levels in your brain. Your doctor may also suggest cognitive behavioral therapy. This type of counseling can help you understand your thoughts and feelings and help you change your behavior accordingly. You can't prevent PMS or PMDD, but the treatments outlined above can help reduce the severity and duration of your symptoms. Long-term outlook for PMS. PMS and PMDD symptoms can recur from month to month, but typically go away after the start of menstruation. A healthy lifestyle and a comprehensive treatment plan can reduce or eliminate symptoms for most women. Treatment of PMS. There isn't a cure for PMS, but there are a number of treatments that can help relieve your symptoms. Continue to use a diary to record your symptoms to see if your treatment is effective. If you keep a symptom diary, you may find that your physical or emotional symptoms are linked with your period. You can then predict more accurately how you will feel at certain times of the month. This helps you plan your time so you can try to prevent being in stressful situations in the second half of your menstrual cycle. Regular exercise may help to improve your symptoms. Aim to do at least 150 minutes, 2.5 hours, of moderate intensity physical activity during the week. Your GP may advise you to eat a diet, such as regular meals that include small amounts of low-sugar, starchy carbohydrates. These include whole grain carbohydrates such as wholemeal bread and porridge. Reducing the amount of salt you eat may minimize bloating and tender breasts that you may have with PMS. Limiting caffeine may also improve breast pain. But more research is needed to prove these effects on PMS, although these changes to your diet may benefit your overall health. At the moment, there is conflicting scientific evidence about taking vitamin B6 supplements for PMS. High doses may damage your small nerve endings, so speak to your GP for advice before you start taking a supplement. If you have pain from premenstrual headaches, backache or other aches and pains, you can take over-the-counter painkillers, such as ibuprofen or paracetamol. Always read the patient information leaflet that comes with your medicine, and if you have any questions, ask your pharmacist for advice. If you have symptoms that disrupt your life, and don't improve with self-help measures or painkillers, contact your GP for advice. He or she may prescribe medicines, depending on the type of symptoms you have. Some of these are listed below. The combined contraceptive pill, for example, one with drospirenone and estrogen, prevents ovulation and may help with some symptoms, possibly by stabilizing the levels of your hormones. Medicines called selective serotonin reuptake inhibitors, SSRIs, such as fluoxetine, can be effective. These are antidepressant medicines, but may help both the physical and behavioral symptoms of PMS. If your symptoms are still severe, your GP may refer you to a specialist. Your specialist may offer you further medicines, which may include the following: a diuretic, water tablet, such as spironolactone, which may help to relieve symptoms, such as tender breasts and bloating, and improve mood. An estrogen patch plus progesterone, which may help to balance out fluctuating hormone levels. However, there isn't enough scientific evidence to know whether there may be long-term side effects from this treatment. A medicine called a gonadotropin analog. This is a synthetic form of the hormone, gonadotropin-releasing hormone, GnRH, which helps to reduce the level of estrogen produced by your body. Your specialist will only offer it to you if you have severe PMS, as it can have harmful side effects, such as osteoporosis,